नमस्ते बिटिया हमेशा खुश रहो कन्या A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Jain. In today's lecture, we are going to discuss about various endocrinal disorders and the systemic examination in cases of endocrinal disorders. What are the various investigations that could be done in case of endocrinal disorders? We will be comparing two systems. One is CVS and the other is the nervous system. So what are the various examination that could be done? So what are the findings that you will see in the CVS system? In the CVS, you will find the bounding pulse with wider pulse pressure that indicates of hyperthyroidism. So if a patient is coming to you with bounding pulse and wide pulse pressure, it will indicate hyperthyroidism. In the nervous system, proximal myopathy with positive Gower sign is seen in Cushing syndrome, thyrotoxicosis, and diabetic amyloidopathy. In CVS, when hypertension occurs in Cone syndrome, Cushing syndrome. So if a patient is coming with hypertension to you can think of Cone syndrome, Cushing syndrome, you can think of thyrotoxicosis, pheochromocytoma, thyrotoxicosis, hypothyroidism, while hypotension occurs in the Addison's disease. So if a patient with hypothyroidism is coming to you can think of Cone syndrome, Cushing syndrome, thyrotoxicosis, pheochromocytoma, thyrotoxicosis, hypothyroidism, and if a patient of hypertension is coming to you can think of Addison's disease. Postural hypotension indicates autonomic dysfunction that is common in diabetics and hypoglycemia. If a patient is coming with peripheral muscle paralysis, it is seen in Cone syndrome and nervous system. Peripheral neuropathies with loss of tendon jerks are seen in diabetes mellitus. If a patient comes to you with hyperreflexia, it is seen in thyrotoxicosis and pheochromocytoma, while delayed reflexes jerks are seen in mixed edema. In CVS, if the patient is coming with arrhythmias, that is atrial fibrillation, it is commonly seen in thyrotoxicosis. Hyperdynamic circulation with flow murmurs occur in thyrotoxicosis. If the patient is coming with ischemic heart disease and congestive heart failure, it may occur in thyrotoxicosis, hypothyroidism, and diabetes. In nervous system, if the patient is coming with carpal tunnel syndrome or entrapment neuropathy, it is seen in hypothyroidism, pregnancy, etc. If the patient is coming with ataxia or gait abnormalities, it is common in peripheral neuropathy, myopathy, and osteomalacia. So these are the common symptoms in CVS and nervous system with which the patient can come to you and you can reach at a probable diagnosis of the complaints, especially related to the endocrine system. So this was all for today. In the next lecture, we are going to discuss the common presenting symptoms of endocrine disease. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. This is all for today. Thank you very much. We will be meeting in the next lecture.